Akili is a digital medicine company. We have a portfolio of products that are prescription digital treatments to target neurological and cognitive processing across a range of disorders. And we build our treatments into fast-paced action video games. So we're committed to taking a new type of product that actually has an entertainment and exciting feel, but fully through the medical path, clinical trials, and FDA. And our pipeline is on the doorstep of big advances along the regulatory and launch path. So we founded Akili in 2011, which was right at the time where you saw a lot of the patient needs continue to increase across neurology and mental health. No new approaches, but new technology in the consumer world. And myself and my co-founders got really excited about the concept of marrying this birth of technology to try to address these needs that have been persistent and growing for the last 20 years in patients across mental health and neuropsychiatry. And we thought it was too big of an opportunity to pass up. We also thought that creating a new type of medicine was too big of an opportunity to pass up. And so we've been on that path for the last 6 years, 7 years. I think this is a new medicine industry. I fundamentally believe in 5 or 10 years that we're going to see doctors prescribing digital therapeutics as medicine, either along with or maybe even as an alternative to pills and drugs, across a range of conditions, not just neurology and psychiatry where we focus, but metabolism, GI, or a range of others. This, I believe, will become commonplace medicine. It will take time to get there, but we're seeing enough evolution of the field, we're seeing enough impact in patients that I believe it's only a time to come. What we need to do is have discussions, but make sure not to get into groupthink. I think there's a pull sometimes, especially in a new industry, to say that there's a single way, a templated way to grow a business in this industry. Right now that's informed by some of the models that are out there in medicine today. I'm not sure I believe that there's one way, and we certainly don't know what that one or more ways are today. So I think the most important thing in terms of a community is exchange ideas, get inspired about where we can learn and where we can draw from, which is both medicine and beyond. Some models in the consumer world, some models in the tech world, so that we can actually continually think about new ways to grow our business model. It's really that exchange of ideas and inspiration that to me is the most important thing with any community gathering in the space. The DTx event series is essentially the first to realize that there's enough here to focus entirely in the digital therapeutics industry to help grow, propel, and catalyze collaboration in that industry. So what you find at the DTx series of events is essentially all of the leading companies, many of the leading thought leaders who are here for the right reason, which is to grow the industry, not to have turf wars, not to sell their own products, but truly to talk about how to further this industry as a whole, and you've got all the right people. So I think this series is one of the preeminent places where we can exchange those ideas in a safe environment where we're all in it for the right reasons.